I'm going to introduce the next speaker. So Mehreen Farrukh is an experienced clinical consultant psychologist with 15 years in mental health and chronic illness management. She specializes in psychological intervention and she works at Aga Khan Specialist Clinic at Peponi. Karibu sana. Welcome.
Good morning, everyone. So I just want to check. Someone told me don't stand behind the podium. Nobody will be able to see you. But I think you can still see me. It's a room full. I was a bit disappointed when I came in the morning. I was like only 15 people and I've worked so hard. So the idea is we've talked about how we eat. We've talked about exercise. And now we need to talk about what we think. Since I came, and I need to figure this one out. So let's try this. The only thing that I've heard is mindset. Your mindset towards nutrition, your mindset towards exercise, your mindset towards diabetes, and your mindset towards pretty much basically what happens is when there is a mind switch, you can pretty much curb everything. So that is what we're trying to do today. So the topic is, of course, the interrelatedness between mental health, sleep, and diabetes. Idea is have your sugars in control, eat well, exercise, keep a check on your sleep, and then, of course, mental health prevails. What happens is that there is a surge in an increase in mental health issues, diabetes, and sleep disorders in Kenya. And the number one reason is that they're being treated in isolation. All in all, it's really a vicious cycle. We don't know what came first, whether it was the egg or the chicken. So that is the interrelatedness that we're trying to bring in today. I won't go too much into diabetes and IDF. I think that's something that's already been explained. So what she's saying is insomnia. So there's a misconception. When we say insomnia, people think that it's the inability to sleep, like you're just not able to sleep. And you've actually hit the bullseye. Insomnia is not being able to sleep or not being able to stay asleep, which is I've slept 2 to 3 hours and then I'm back up again and I'm not able to go back to sleep. So the reason why we're not able to manage insomnia in diabetic patients, the number one is constant urination. So I went to sleep and everything was fine and I did what you asked me to do, and then I just kept going to the toilet and I wasn't able to go back to sleep. That is where the interrelatedness comes in. We're not able to help them until and unless we collaborate with you. The last one is restless leg syndrome, which is the constant jerking of the legs. I mean, how are you going to sleep when your leg is constantly moving? Patients like that would say, so I haven't slept with my spouse for the entire year, it's breaking homes, it's breaking marriages. This usually also happens right before they're presenting. I clearly don't have it because my leg isn't shaking, but apart from obstructive sleep apnea and insomnia, restless leg syndrome is actually the most detrimental. So the idea is the link is just basically very complex. Like I said, we don't know what came first. If I was to take it home and personalize it with a little bit of self-disclosure, I actually had my own father who had diabetes, a sleeping disorder, which was sleep apnea, and it was years later that we were like, oh, now because I'm educated, I know that they were completely interrelated. So we don't know what came first. The idea is for us to pretty much manage sleep, mental health, and diabetes, and we can't do that without you because I'm not a diabetologist. It's a three-way connection, but what is our role as psychologists? How can I help you, how can psychologists help a patient with diabetes wanting holistic care? The idea is for us as specialists, there is only one common link between the three: diabetes, sleep, and mental health is the cortisol level. The moment with therapeutic interventions we manage the cortisol level, that's a game changer for your diabetic patients, for our patients, and pretty much it's what we do is when I know some of you will be thinking, yeah, but it's entirely different. So when we have our patients come in, we actually ask them, so, you know, have you been taking your medication? Are you checking your sugars? I know that now I need to ask them, have you been exercising? Have you been eating well? Stuff like that. So it's all interrelated. So we're managing medications, emotions, sleep, and hopefully now exercise and what they eat. How it begins, let's start with, I'd really like to use the example of Mr. Peter yesterday, because those are the kind of people we get. So we have someone coming in, and they're showing all the symptoms of anxiety, all the symptoms of depression. I know that he mentioned feeling restless, feeling anxious. I think I can see him. Are you? Yeah, so I'm quoting you. And thank you so much. I think you were the star of the show yesterday. It was very empowering. If we had a patient like that coming in, and if I was to give him the BDI, which is the Beck's Depression Inventory, or the GAD-7, Generalized Anxiety Disorder Test, he would immediately be diagnosed with active anxiety and depression. But because I know that this is someone who has diabetes, the first thing that I will do is the DDT, the Diabetic Distress Test. That is the first thing that we will do. So number one, when we have patients who have a diagnosis of diabetes, we don't immediately label them as patients with anxiety, patients with depression. We do the DDT first. And then that is how we take into account the intervention. So let's get into the psychological support. Has anyone heard of this, CBT? Yes? Yeah? Great, so this is something that we've customized. I haven't done that. So these are now people who are all the way researchers who've actually come up with cognitive behavioral therapy for diabetes, which is a milestone. What that does is that it is changing your thought process. We are what we think. We are what we think about our exercise. We are what we think about our diagnosis. We are what we think about our diabetic condition. So CBT is a very customized cognitive behavioral therapy technique that changes a patient's mindset towards their diabetes, and that's a game changer. Easier said than done. Of course, there are techniques that we use to change that mindset. And then we have CBT for insomnia, which is cognitive behavioral